It hardly seems possible, but it was almost 9 months to the day when COVID was first showing up in Minnesota. The darkest days of our year as we move towards the winter season on the 21st, but it's also, I think, fitting. This is also the week after that happens that the days start getting longer. And it sure felt like that came early this week. The sun started shining early when we arrived at the VA hospital and the first doses of vaccine were arriving. We went back yesterday and watched one of our heroes, a frontline nurse in a COVID ward, who treats our heroes at the VA hospital in Minneapolis, receive the first dosage of COVID-19 vaccine. All of those things are big steps to the sun coming up and for a better day, and all of those things are to bring an end to this long, dark winter of COVID-19. And rest assured, this pandemic will end. This pandemic is starting to transfer, but there's a lot of work to be done. There's a lot of things we have to do. So I want to take a little bit of time, Minnesota. Again, sun's rising. Things are different. Things are changing, but we are not out of the woods yet. We know this vaccine has a tendency, the asymptomatic spread we were just discussing here before we started is troubling. To see a respiratory disease that does that is unprecedented, and that causes us a lot of problems. But we've learned much in the 9 months. And here's what we know. When I addressed you in November and asked for us to do a pause on some of our activities, things that we've learned over 9 months contribute to the community spread, that put pressure on our hospital systems, that make it more difficult for our first responders to provide the safety and keep our children out of school. So we made that pause. Cases were growing. Families were starting to struggle, and this distance learning is hard, and we're going to address that. Surge in hospitalization left hospitals on the brink of catastrophic capacity, and we had to take actions. You're going to hear in just a little bit from Dr. Ken Holman of CentraCare. CentraCare is a major healthcare system centered out of St. Cloud, but serves about 800,000 Minnesotans. Dr. Holman's understanding of not only delivery of healthcare, the business side of healthcare, but also understanding what it takes to deliver in rural America. And he has been there as an advisor. He's also been there as someone who's asked us to question all of our assumptions. How do we make this work? And those are the people we're listening to when we looked at what happened here. The graph you're looking at starts on the left side with March. That little bump you see is what we thought at the time was a major May spike, why we were trying to build up PPE, why we were trying to protect our hospitals. And then Minnesotans, you did the work. It dropped and you kept it flat. But just like Commissioner Malcolm, just like Dr. Osterholm, just like so many people predicted, COVID would come roaring back with a second wave in, accurately predicted, probably late fall, early winter. What you see there was November as it shot straight to the top. At the top of that peak, or right certainly before it, is where we asked you to pause on November 18th. It's where we asked folks to make very difficult decisions about not being with their family over Thanksgiving. And it's where we asked the almost untenable situation for small businesses, especially restaurants and bars, to stop doing what they do best and to stop their livelihood. Well, what you're seeing after that is the approximately 3 weeks afterwards, and it's coming down. But I want to note something here. As you're looking at that graph, that first bump in May put us into a caution or a red territory. The line before it starts going straight up, we have to be at least there to start taking some of the pressure off. And while it feels, and I am incredibly grateful of the sacrifices you made to pull that back down, we've still got a ways to go. And that 4-week pause was hard. Again, the social gatherings piece, and you did it. As we compare data, even in surrounding areas, because this tends to be very regional, Minnesota's post-Thanksgiving drop-off has been steeper than our surrounding states, and that is a testament to all of you. We shut down those things we like to do, and again, it's incredibly hard. Youth sports, the advocates who are out there for youth sports. If I'm not in this job, I'm in that camp. It's what I did my whole life. I understand what comes out of that. It's not just about sports and winning a game. It's about the holistic part of a child and learning what it takes to be part of a team. It's the mental and physical aspects of it that tie right into academics in our schools. So I want to just be very clear. The passion around youth sports, fitness, activities, those things are healthy. And the activities and asking for that is a healthy thing. But what we know about the virus is, if we're in an activity that puts people who aren't in the same family in close indoor proximity to one another for long periods of time unmasked, the spread is at the highest in that setting. So what we look at is what type of activities can we still do? The evidence is pretty strong, as I said. You're making a difference. But community spread is still well above 30% in our communities. And again, just to remind you, community spread is where we don't know where it's coming from. Community spread is when that healthcare worker stops at daycare or stops to fill up with gas, someone who's asymptomatic and maybe doesn't have a mask on spreads that to that person. And the next thing we know, we either have a case in a long-term care facility or we have an RN or a doctor who's out. That adds to the stress in those situations. And the hospitals still remain concerned about capacity. So here's what we do know again. The community spread lines, as you saw, we'd like to see it well below 10%. We certainly don't want to see it above 30%. And what you're looking in the number of cases that we're starting to see, we're not even out of the high-risk category. All the work we did, all the things that the pause did, still didn't do it. And just to be absolutely clear, as sure as that sun will rise in the east, when we have higher cases, It is followed by a lag and higher hospitalizations, followed by a lag, ICU admittance, followed by the unfortunately inevitable rises in deaths. And I have to say, with all this work we've done, we're still reporting 92 deaths of our neighbors and our fellow Minnesotans today. That's the reality we're in. We've lost more Minnesotans in a 6-day period than we lose an entire year on our highways on any given year. And that doesn't appear at this point in time to be tailing off a whole lot. Again, you're looking at case growth, the drop-off you've seen, and then you're looking at hospitalization rates. I remind you, we were super worried on that first bump on the bottom chart on the hospitalization rates. One is we weren't as prepared because of PPE. We weren't as prepared and understood as much about COVID-19. Through the hard work and preparation, and Dr. Holman will talk a little bit about it, Minnesota is fairly unique in the collaboration amongst our healthcare entities, that our site picture into beds and collaboration and moving patients is probably as strong as anywhere in the country. Because of that, we were able to pop above that high risk and still start to bring that down. That first drop-off on the bottom chart that you see, that's where we asked folks to stay home, and we closed our schools, and we did some of those. And then you kept it below the high risk. And then what you're looking at is the November spike and the outrageous rise of what happened. That was what caused the pause. Your actions are why it's dropping back off on the end. But again, I would remind you, it has not come anywhere near where we need to get to down below. So again, going back to March, we asked you to flatten the curve. And I just want to be very candid with folks. I've heard people say this, well, you keep moving the goalpost, Governor, about what we're supposed to do in this. And my response to that is the game continues to change, and it's no game. It's a virus that takes lives. We've learned more about it. We do know now, because of what our healthcare folks have done, our survival rate is higher than it was in March. We know the treatments that will work, and more of those are coming on every day. But we were very clear. We were not prepared. There was no strategic stockpile. We did not know if this was being spread by touching things as much or if it was aerosol or what was happening. So we asked to ramp up PPE, build hospital capacity. You did it. We turned the dials back down. We opened things and people were doing more. Our economy was open as any state in the nation, and our economic activity seemed to reflect that in state budget numbers. So we managed the virus over the summer. We started getting ready for schools. We issued the state learning plan, and we did the things that we needed to do that weren't ready and certainly weren't being done on a national level. We increased that capacity to storehouse PPE, to build up a testing system that was state-owned and wasn't dependent on supply chains outside of the state of Minnesota, so that we could track this virus. And then we got to where we hoped we would always avoid, but we got to it. We got the November surge, and that really focused on keeping folks out of the hospital the best we could. We had the PPE, but what we found out in November, late October, early November, up until right now, that we could have PPE, we could have beds, we could have ventilators, we could have the best therapeutics, but you can't replace the nurse or the doctor who's out with it. You can't replace the workforce because of community spread, and you can't build up enough of that quickly enough if it comes as fast as it did. And our approach has always been, it's not about changing where the goalposts were. It's about adapting and learning what the virus is doing. It's about using new technologies and new strategies, and it was always, and it remains about, how do we control the spread of COVID-19 using the best science and the best medicine, while focusing on the well-being, the holistic well-being. There's no doubt this is having immense pressures on other physical sides of people's well-being, of mental sides of well-being, of the social side of well-being. And then how do we make sure we protect the economy? Because all of those things come together. And that spot in the middle is the Stay Safe Minnesota. So we've done that. We've tried to balance that. We've tried to protect hospital capacity. And what we know now is, of what we've learned, where we're at, and as we're coming over this latest peak and heading into the trough, there's a very real chance, and the probability is quite high as this virus has taken a path, that there will be another peak coming. The difference can be on this is what we've learned and what we can do by masking, social distancing, washing hands. And now, and I want to be very careful about this, it's going to take some time, but I also think we owe it to each and every one of us to celebrate a little bit this week. The vaccines are coming, not as fast as we'd like them. It's going to take some time to get that out there, but that is a change to how we approach things that is huge. And so we're looking at, and our next steps on this, again, to minimize death and long-term impacts. But one of the things that we know that we're prepared for, we've learned the rest of, I shouldn't say the rest, there are certain states and internationally, the epidemiology around our schools provides us, and what we've learned over these several months, provides us an opportunity to get our kids back into school, into that in-person learning. So today, one of the things we're going to do is we're going to adjust the dials. And again, I want to just recognize this. There is nothing fair about COVID-19. And where it impacts certain industries more than others, it feels incredibly painful to those industries, because it is. And we needed to make sure, and I'm proud to say in a little bit, we'll talk about that, if we're going to ask folks to sacrifice in the name of public health for their neighbors, then we as neighbors need to be prepared to help them. And that's what the legislature did this week in a nearly $250 million package of relief specifically aimed at small businesses and the hospitality industry. But we're going to support students and families. We're going to continue the effort to slow the risk of spread, and we're going to protect our hospitals. That's what this is meant to do. So here's what today's announcement is. The pause ends this Friday at 11:59 p.m. What will happen starting at 12 a.m. on Saturday, the 19th, going forward is we're going to prioritize and make sure that all of this was aimed at getting our littlest learners back into the classroom. And I just want to pause for a moment and thank both parents. I'm trying to distance learn. My wife is trying to distance learn with our 8th grader. So many of you out there, as you're working, you're frontline workers. We've got kindergartners that should have walked through that door for the first day and been in that nurturing place where many of us, 50 years later, I can still remember Miss O'Keefe waiting at the door on that very first day. Don't think that doesn't make a lifelong impression. Don't think that that nurturing environment where it was bringing out the best in each one of those children, each one of those classmates who stood with me, isn't critically important. We recognize that. And the desire to get those children back in the classroom is so intense. And I want to take a moment to thank our teachers. This has been hellish for them to try and figure out how to deliver in person, how to shift and do hybrid, how to teach in a classroom where some of your students are on a video screen and others are separated across the room. How do you do it when some of your children don't have that access to that computer screen and you're not sure where they're at? What we know for certain is, and what we found out during this pandemic, frontline healthcare workers, grocery store clerks, truck drivers, people we might have taken for granted or thought they were just doing their job, have become so invaluable. I can tell you this again, and I will clearly state I am somewhat biased because I've done it my whole life, the value of that classroom teacher, the value of not only the academics in that classroom, but the social emotional learning. That is the safest and best place for many of our children to be, is in that classroom. And now we believe we have both the experience, the knowledge, and the resources necessary to make that not only an emotionally and academically safe place, but a physically health-wise safe place for those students to be. So what we do know is our youngest children are less susceptible to serious complications, and I don't want to minimize that. One child getting COVID is too many, but what we've learned is how to reduce that spread. So on January 18th, every elementary school may choose in person if they can implement their strategies. And I want to be clear, some were prepared to go before that. This is going to take close collaboration because it will be local school districts and teachers along with their parents making these decisions. This is a monumental move to try and get this back into place. It's going to take us a little bit of time. Many are starting that as we speak. But talking about the sun rising, we're not too far away from that kindergartner getting that experience that I had with Miss O'Keefe and each of you had with your teachers, getting back in person in that classroom, and those first and second graders. And the way we'll do this, and we'll talk in a little more detail, is we'll get the littlest ones in first and we'll start rolling back. And now the plan is to get that as soon as we possibly can and as safely as we possibly can, working with district, working with teachers, understanding that we can't lose that teacher workforce. So we're going to have to be protected. We will be stepping up the testing in those schools at a pretty high rate. All of those things we believe can protect that workforce, make that school safe, and accomplish what every single one of us knows has to be a top priority, getting a quality education for every single one of our children. We're going to do some things around small social gatherings.
And here's what I just want to be clear about. Inside, we're recommending no indoor gatherings, but I want to be clear with other households. What we'd say is, and what this guidance will put out is, one additional household, 10 people max, limit your time and wear a mask. You did so much, Minnesota, throughout 9 months. You continue to do it. You did it over Thanksgiving. I'm asking you not to let down at this point, but I'm also recognizing the desire to be with your family during the Hanukkah celebration, Christmas, New Year is strong. And folks who care deeply and believe COVID is real and believe that they need to stop the spread to others still want to be with their families in a very visceral and very human way. So I've said this time and time again, doing just say no is a good theory if it was around just say no to your kids to not use drugs. It's a far better thing to try and do the best we can to try and mitigate that. And I want to be clear, you're not going to take all the risk out, but there's things you can do. You can wear a mask, you can separate, keep it to one other family. Try and keep that time limited to that you're there. But just a clear understanding, wanting to be with your families over the holidays does not make you a bad person. It makes you a really good person. And we need to figure out how to strike that balance. Outdoor events and entertainment, Minnesotans, we're bold North people. We can thrive in this, and we do thrive in this. And it might be, as you see here, Christmas caroling at a safe distance with one another, getting out and doing some things together, watching what happens as you're playing some pond hockey or you're cross-country skiing together. We need to make sure that that happens. And gyms and fitness studios. And again, this isn't about one group versus another. We're all in this fight together. This is Minnesota's fight against COVID-19. This is Minnesota's fight to protect our healthcare industry. It's our Minnesota's fight to make sure that we provide the support to our businesses. So we're going to get in there. And it's not lost on me. We're fighting a healthcare pandemic. Why would we not want people to be as healthy as they could, those that are going to gyms? I just remind folks, indoor activities with people close together for extended period of times with someone not from their family increases this risk of COVID spread exponentially, which leads to that cascade of cases, infections, hospitalizations, and deaths. And so what we're doing is, and I want to congratulate the folks in the fitness industry, you have figured out smart ways and thought about things. So we hear you on that. So we're making some changes, get people back in there, make sure that they're able to socially distance. The classes that you teach, we think you'll be able to come back on January 4th. And this next one on youth and adult sports. We need to get kids playing again. We know that. We know that the numbers show that kids aren't as susceptible, but the difference is some people ask, what's the difference between a gym and youth sports? One of the things is the first one, you have people separated, you have an individual, you have them masked for a shorter period of time, as opposed to different households close together with one another. These are all things that are just the nature of COVID-19. But we're coming back with them. We know we can make this work. And as I've said, this is really about the whole child. This is really about the opportunities for them, physical, mental, teamwork, all of the things that go with it. And then the tough ones. Again, I can't say it enough times. This is totally unfair, and the virus has hit disproportionately into communities of color, and from a business perspective, it's hit those activities that are indoor, seated or standing activities that involve extended periods of time without a mask on with people not in your family. That is the description of a bar, a restaurant, a music venue, any of those things. So we're going to continue the pause on the indoor service until January 11th. And we did get requests, especially from our breweries, to have outdoor service available. So outdoor service will be available. And I just want to be clear, I know we're in Minnesota and I know it's the middle of December. I know this doesn't make folks whole, but like so many of these things, we're trying to move as much as we can to mitigate the risk, to provide some of that economic activity while getting the most benefit on the safety and the health side of this. So they're going to be open. And again, I would go back to this. We're bold north. The breweries tell me if we can do this, their fire pits and heaters will be open and people will be drinking brews outside in December and January. Then we should make that happen if that's the ability and the health department believes we can. And the same thing with indoor venues. We'll talk some more details on that. Commissioner Grove and Commissioner Malcolm will be joining me for the question and answer here following this. And the biggest thing, This is what needed to be done every time. This is what the federal government needed to do continuously since May and when we did it the first time. If we are going to ask a particular business sector or someone to step out and help us with public health, it has to be coupled with the aid necessary to allow them to do that financially. And one of the things, and I want to give a big thank you to the folks in the legislature and the folks who made this happen, we're going to move just about $250 million of aid as quickly as possible. I am going to sign here within the next 20 minutes or so that bill into law. We are already working out how to get those checks out over at the Revenue Department under Commissioner Doty and the help of Commissioner Grove. They're going to be directed, targeted, and help them. It's an important step, but again, to those businesses, this does no way make you whole. But this is a part of what we've done every time in this country when we've asked people to step back and sacrifice. If it was asking Ford Motor Company to quit making automobiles and make armaments for World War II, we made sure we compensated them, paid them, and keep folks working. That'll be coupled with unemployment benefits for folks who were not able to continue working. This is probably one of the, if not the most robust state package of support in the nation. I am feeling also very helpful that this package, another one can come on top of it from the federal government that sounds like that may happen this week. Those things should allow for some cushion to those businesses until we bridge this gap and get into the new year. So we're keeping the hand on the dial. I'm asking you, we're not out of the woods. You still need to do those basic things, and the reason for it is we can't overwhelm the healthcare system. We don't know the long-term effects of infections on this. We are still at a dangerously high level of community spread. Our ICU bed capacities are very high. Our test positivity rates was 11.6% today still. It should be under 5 before we can start breathing a sigh of relief. And our deaths were at 92. But you brought the curve down. You made the sacrifices necessary. Space is starting to open up, and that sunshine I told you about is here. The COVID vaccines are here and more are on the way. So we'll continue to monitor this. We'll continue to make the hard decisions as Minnesotans to save our neighbors. And if we do so, we can make a difference. So now I'd like to introduce to you Dr. Ken Holman, the CEO of CentraCare. As I said earlier, an expert in the delivery of care, understands the business and the humanity behind healthcare delivery, but more importantly, understands how you do this in a rural setting. And with that, Dr. Holman.
Good afternoon, and thank you, Governor. You mentioned 9 months ago, and while you were speaking, I was reflecting on 9 months ago. Thank you for 9 months of collaboration. Early on, when the pandemic hit Minnesota, there's a recognition that this is really a once-in-a-generational, once-in-a-100-year episode of public health crisis. So for 9 months, we have been collaborating with the Governor, Commissioner Malcolm, and their entire team in remarkable ways. That collaboration includes the other health systems of Minnesota and hospitals through the Minnesota Hospital Association, as well as many others, as we have tried to deliver equipment, drugs, and people to take care of you, the citizens of Minnesota. Our 13,000 employees have had a common purpose the last 9 months. How do we provide care during this COVID pandemic? How do we provide care for the other healthcare needs of our citizens? And how do we support our community? And I know I join with the other healthcare leaders in our state as they all have united behind that common purpose. So where are we at today? I'm going to start with a story. Last week, I rounded in the critical care unit, one of our critical care units at St. Cloud Hospital. And I'd like to have you picture a ward with a hallway down the middle with 35 ICU beds, full of patients suffering from severe COVID, on a ventilator, unable to see their family, multiple drugs going at the same time, folks all over trying to help, a remarkable dedication by our staff. And I stopped and talked to one of our young male nurses, probably 35. And I asked him what was going on, how the day was going. And he certainly talked professionally, but what struck me was the end of the comment when he talked about how he was scared to go home to his pregnant wife with their first child. because he was scared of bringing the virus home and infecting his wife and his unyet born baby. And talking through that, it certainly emphasized to me, and the governor's mentioned it, and Jan has mentioned it, the enormous personal toll that this is taking on our workers. We have planned, we have collaborated, but it still does not obviate the toll that it has taken on our workforce and on you, the citizens of Minnesota. Most recently, our work has been to try to manage the surge that has been repeatedly mentioned. We have increased our capacity for both medical surgical beds, ICU beds. We have had to delay procedures or postpone procedures and visits. We have had sometimes up to 1,000 of our employees who are unable to work on any given day for a number of really good reasons. So in the context of a surge and a pandemic that is unparalleled in human history, since 1918 at least, how do we come together to work and take care of each other? As the governor mentioned, though, there is hope. The most recent numbers indicate that while our numbers are still way too high, you have helped us with the curve. And that's what I'd like to reemphasize as I talk to this young male nurse. I have frequently asked, what can we do differently? And our physicians and nurses and this young male nurse simply said, spread the message that we don't want people to die. Spread the message around masking, hand washing, social distancing. Pass the message of personal accountability. And you listened. As the governor mentioned, the last 2 to 3 weeks have seen the numbers flatten out and even start to decrease, although they are still too high. So while we all deeply appreciate your engagement, I am worried. I am worried about the next few weeks as the end of the year approaches, and I continue to worry about the strain on our staff and facilities and on our citizens. We have a weekly conference between the 400 leaders in Centricare. And one of our young leaders 2 weeks ago said something that was extraordinarily profound. And he said the following: the number one and most important calling of your life is the next 6 months. The next 6 months. In other words, as leaders, how do we come together and manage the next 6 months? So I would finish with some comments about that word, together. How do we together manage the spread of this virus until we have some notion of herd immunity? Together. How do we collectively embrace measures that keep the public safe through hand washing, masking, social distancing, and the many other initiatives that are undertaken? Together, how do we support our businesses, our schools? The toll on all of us is remarkable. We can do more. How do we support each other differently and better together? And that hope of tomorrow around the vaccine requires us to be together. The vaccine will be useless unless we collectively, together, get vaccinated so that we can put this virus behind us. So the theme that I would embrace for our organization is a relentless commitment to our patients and our communities together. And I would finish with one of my favorite holiday stories. And it relates to the Christmas truce of 1914. And put yourself in World War I, where there's death and misery everywhere. And out of the trenches comes troops on both sides singing Stille Nacht, Heilige Nacht, Silent Night. So in this holiday season, let's all get together, find ways to support each other better, enjoy this special season, and look forward to a new tomorrow. Thank you, Governor.
Thank you to Ken, Center Care, and all of our hospital systems. We are blessed to have you. We are grateful for it. And we're going to go over and take some questions here in just a few minutes over at Revenue. But I would end with, Ken, thank you for that message. Thank you for the together piece. Minnesotans, we can see the end of this thing. Ken's right. We got 6 months to show who we are, and you've shown it. You've fought this thing. You've cared for your neighbors. You've weathered this. And as I've said before, and I said it in March, we'll get through this because we're a resilient people full of grit and goodwill. We care about our neighbors, and we know what it means to be that decent neighbor. So let's continue on with it. Let's get through this. Thank you, Minnesota. be spread begin, and that's where we need to make a difference. Today we're doing something, as I sign this piece of legislation to provide support to those small businesses. This is the way this should be done. This is the way that most nations in the world did it. This is the way we did it back in May when this started, is if you're going to ask businesses to sacrifice for the good of public health, it needs to be accompanied with the economic benefits. When we ask Minnesotans to stay home, that's why that the $1,200 stimulus check was there. That's why we added additional money on top of unemployment insurance. This is a tool that was used everywhere else in the world, and it was used in the early part of the pandemic here in the United States. And then because of the inability of the federal government to move anything, states were left with the task of trying to turn the dials, trying to mitigate the spread of COVID-19 without having the tools necessary to offset the economic side effects that would come from it. So today, this is the way this should be done. And I'll have to tell you, this is what we believe is one of the most, if not the most robust aid package that a state did alone. And so I want to make sure that I give thanks to those folks who made this happen. Speaker of the House, Hortman, Leader Dowd, Leader Winkler, Representative Mahoney, Representative Knorr, and Representative Baker in the Minnesota House did extensive work on this, along with Senator Kent, Senator Gazelka, and Senator Pratt. True compromise, working in the best interest. Commissioner Grove can talk about some of the details, but $88 million in direct payments to restaurants, bars, and gyms, $14 million for convention centers and movie theaters, and then something Minnesota has done uniquely and unlike anywhere else in the country, $115 million roughly for economically significant businesses, including nonprofits, to be distributed by the counties. If you recall the CARES Act money and the help from D.C. in the first bill back in May, Minnesota gave more of a percentage of our CARES dollars to local states and our cities and counties, and kept a smaller portion for the state than any other state in the union. This follows that pattern. These are folks that know best in their community. They have the ability to get them out. So I want to take a second here to sign this piece of legislation. I can tell you we're in the Department of Revenue building. Commissioner Doty has already been, as they were working side by side with the folks negotiating this piece of legislation, getting the things and the staff necessary to start getting ready to process these in as timely a manner as possible to get this aid to folks when they need it. So that is all happening. So I'll just step down, take it, and then we'll come back up and take some questions.
Again, Minnesotans proved that we could work in a bipartisan manner, we could work in divided government. This piece of legislation will now be operationalized to get that aid out both to those small businesses and ensuring that unemployment insurance is extended to other persons. Thank you.
With that, I'd be glad to answer some questions.
Governor Walz, Tom Hauser from KSTP. While you say there should be reason for optimism for business owners because of this aid package, the reaction from the industry, especially Hospitality Minnesota and some others, they've used words like devastating, shameful, and unjust. One restaurant owner told me today, allowing them to open outdoors for dining is the equivalent of telling pool operators they can open in the middle of winter outdoors. How do you respond to that?
Well, that move was actually a request from the industry. That was a request from the breweries to allow them to open up outside. Many of those breweries especially have created the space necessary. They said there is a large crowd who does that. There was no belief that that would fix all of them, but that was a request made to us by the industry. Once again,
just to interrupt, so the microbrewery industry, but not the broader bar and restaurant industry, correct? They were not requesting just to have outdoor dining.
No, I mean, I wouldn't make the case. I mean, I live in Minnesota too, Tom. It's cold outside. People don't want to eat outside a lot of times. That was another one of those moves that we made that the breweries and some of these brew pubs wanted to be able to do that. So no, that I certainly, again, if that's not the right thing for your business, you won't do it. And again, I would get back to this. 92 people died today. I was just with and have a list of every single hospital system in the state that says if we don't make these moves, we're going to overwhelm the system. This idea that this is a battle amongst one industry or another is simply a false analogy. This is us as a state fighting against COVID-19. One of the things we're trying to do is to try and provide that relief to them. The fact is, and it's indisputable, that when people are in close contact without a mask indoors next to people who aren't in that family, community spread happens. That just happens to be that industry. So there's no illusion. Certainly outdoor dining isn't the fix to that. Certainly this piece of legislation is enough. The federal government needs to move and do something there, and then we need to get to the other side of this. So again, we're seeing it. People understand this. These numbers are down regardless of if you have a capacity limit in states that don't have this. Reservations at restaurants are still way down. We have to beat the virus before the economy comes back. And as I've said all along on this, it is not fair. It is hitting those types of businesses harder than others. That's why we're targeting the relief specifically to those businesses. Mary.
Governor, what about the restaurants, bars, businesses who have said this week in defiance they are planning to open anyway? The number 100, 200, you know, it could be growing. That's just what we know about. How much do you want them enforced?
Well, Minnesotans know that we're in this together. 15,000 restaurants are doing what they need to do, and they have done, as of millions of Minnesotans making the right call. I certainly want to be clear about this. I think people who are desperate in their businesses, that certainly doesn't make them bad people. I don't believe these are people that don't care about their neighbors getting sick. But the fact is, whether it be inspections for salmonella poisoning or putting on drivers' speed, have these things because it protects the broader good. And so this has been held up. The courts make that determination. We would fully expect, as we've done all along, to talk to people to find a good outcome for that. And get to a space where folks understand. We're trying to provide some support while they're there. We understand that they're hurting. But again, you can't just take off the equation that the United States has the highest number of hospitalizations at any time during this. Our ICU bed capacity, as you heard from the hospital associations and Dr. Holman, is at a critical point. 92 of our neighbors died, and it's not slowing down. So these are mitigation measures we put in. They are painful. We're trying to do everything we can to alleviate that pain, but I fully expect, just as we've done all along here, the vast majority of Minnesotans are making the sacrifice for their neighbors.
Governor, if I could follow up, how are you going to enforce that? Is it going to be state officials, local officials,
the tools that
authorities? I mean, could there be arrests? How, if there's hundreds, are you really prepared to
Mayor, I'm not speculating on that. This is health directives that are put out there. If the number is 200, it's a third of 1% of the folks who've been out there. We'll handle those on a case-by-case basis. The vast majority do it. As I've said all along, it's nobody's intention to try and arrest someone. It's nobody's intention to try and make someone difficult. It's everyone's intention to stop the spread of the virus so our children can get back in school, so that our hospitals are not overwhelmed, and so that all of these other industries are able to continue on and we can provide the support for these folks. So, yes, Dave.
Governor, if you could talk a little bit about schools, or maybe somebody else could, within the classroom itself, this idea that the young kids do not have to be actually socially distanced, will they have to wear masks? And maybe you can talk about the research that led you to the idea that teachers will be extra safe if they wear a mask and a face shield.
Yeah. There we go.
Good afternoon. Thank you very much for that question. I think that your first question was really to focus on the student aspect. And from the very beginning, plan when we released it at the end of July, in-person learning always had the component where students did not need to be physically distanced. And so that is one of the pieces that we are going to continue to implement. And we did say, though, that they did need to wear masks. It's part of one of the executive orders, and so they will continue to wear masks in addition to having their staff wear masks and face shields. And in our partnership with the Department of Health, and I'm sure Commissioner Malcolm would also be able to talk about this, that is one of the mitigating factors that we knew that we would be able to implement in order to ensure that our students continue to remain safe, but so do our staff. We want our students to be able to come back in, and it gives us the opportunity to not only utilize masks and face shields, but some of the other strategies that we know have been successful in other states.
Yeah, if you could, what is the actual data behind the adding in the face shield on top of the mask?
I'm going to let Commissioner Malcolm step up with this one.
Good afternoon. I don't have specific data for you on the percentage improvement or decrease in transmission with a face shield and a mask. We can see if that exists. But what we've learned from working with other with high-risk settings, such as healthcare and some of the early work we did with some of the large food processing plants, is ways to successfully mitigate even in settings where folks are in close contact with people who are, in the case of healthcare settings, known to be positive, obviously. So there we've learned, just the benefits of that extra layer of protection. So it's an additive layer of protection. I can see if we've got some numeric data for you, but it's really kind of what we've learned as we've gone along in working with other workplaces.
Just one last point of clarification. Is it correct that Fairview actually does have some kind of that with you and that helped inform this?
They may. I'll certainly check into that. I'm not personally familiar with those data, but if it exists, we'll certainly get back to you.
Okay, thank you.
Governor, if I may, you said that the pandemic isn't slowing down, but your own data shows that it is slowing down. Hospitalizations are reducing, cases are reducing. You've been actually prescient on this, saying those would peak in staggered approaches, and that's what's happening. So if it is slowing down, are you sure these are necessary given the progress that you're seeing?
I didn't say it's not slowing down. I said when I showed the graph that we went from really horrendous to just horrendous. And so the degree of difference there is when you looked at it, and I put that chart out there to show that, because there's a tendency to believe that there's this oscillation that we moved up, we put in mitigation efforts, and we came back down. We've not come all that way, but what we do believe is that we can single out the things where we get the biggest bang for the buck, if you will, on the mitigation efforts, causing the least amount. Again, that doesn't make it any better for specifically bars and restaurants, the place where we can get transmission rates lower and then start to bring that back down. But no, you're right, and here's what I think everybody needs to be clear in the slides I showed earlier. So far at this point, we've got a pretty good understanding of this, and I would say Commissioner Malcolm and Dr. Ostrom are the ones talking about this. If you go back and look at some of your notes, in July, I remember standing right here when Commissioner Malcolm was worried about a November surge that would come right around the holidays, and it might be bigger. What we do believe is probably February, the way this thing has been, that there may be coming back. Now, the variables in that are still kind of hard to tell. We don't know, and it's probably too soon for the vaccine to be making a major impact on that, but maybe some of these mitigation efforts. So what we believe is turning that dial to fit this. The surge is coming down, but it was so incredibly high that we're still in that high-risk category.
Governor?
Yes.
Governor Marielle with WCCO. How are you going to mandate the outdoor seating when it comes to tents? Will restaurants be able to have a sort of covering, or does it have to be completely open air?
No, it's a great question. Across the country, we've seen a lot of different innovations in terms of how to get outdoor seating right. What the health department has stipulated is that outdoor tents are okay so long as 2 of the walls are missing to create some airflow. So if you can have sort of 2 walls on your structures and obviously a roof, but having that side wall removed will help increase airflow and make sure that those environments are safe. There's also a curfew of 10 p.m. in those settings, tabletops limited to 4. But we know some Minnesota business owners are innovative, and they've found a way to make this work outside. We know for 99.9% of the businesses that will not be an option, but for some it will. And so being congruent with some of the other shifts that we've made, we felt it important to make that possible.
Commissioner, what about those igloo structures that some of the brew pubs are coming out with? Clearly those don't have openings on 2 sides. Will that not satisfy the requirements?
Yeah, I mean, it depends on the structure, but if I am imagining what you're describing, you're essentially recreating an indoor environment outdoors, and if there's 4 walls or if it's enclosed, then in fact it wouldn't be allowed under the current guidance.
Governor, Ricardo Lopez here from the Minnesota Reformer. My question has to do with the gyms. I wanted to get a little bit of elaboration on the decision to reopen them at 25% capacity. As you know, gyms have been lobbying and pointing to data that they say showed that they are not a significant source of outbreaks, but MDH has other data. Just kind of a two-part question. Did any of that lobbying have any impact on reopening them this Saturday? And secondly, is there anything else that your administration can do to be more transparent about?
Well, on the transparency question, we have consistently been rated first of the 50 states in our pandemic data that's out there. We can always do better, I think. The one thing I've noticed, and most of you know how this works, is data doesn't answer the question. It can lead you to the question to ask, and it can also be used in certain ways. And I've seen folks who are saying, and Commissioner Malcolm and I have had this conversation, well, there's a small percentage of folks who get there. Well, the data for us shows that those primary infections are there, and then the secondary and tertiary infections start to spread it out. I think what we've learned during this time is that there's also just the observable aspect of COVID-19. If you are indoors near people who aren't in your family without a mask for an extended period of time, more people are going to get COVID. And so as far as the data, Jan, I don't know if you want to talk about this. We're following it. I would say this, that the data and how we're looking at it is the way almost every other state and nation is looking at it. And interpreting that, is there a little bit of difference on how people interpret it? Certainly, I think there could be, but I certainly believe, and again, I would say this about the healthcare industry, I would say it about bars and restaurants, I'd say it about schools and things like that. Nobody's debating that we want to do these things, especially in the fitness industry. Of course it makes sense to want people who want to be in there to be as fit as possible, to do everything they can, but we wanted to see that at that top of that peak, and as the question that got asked earlier is, we think it gives us the ability to make those calculated risks, to turn that dial a little more, to bring them back. As that number continues to drop, turn it a little more. Peter?
Hi, thanks. This might be for Department of Health. We're getting a reaction today from some in the industry, and they all tend to cite their own data. Gyms aren't the problem. Bars and restaurants are very low infection rates. Even social gatherings are low infection rates. Can you respond to that, please? Because they say either you won't give them data, or the data you've given them proves their point. And if all that is true, where the hell are people getting infected if in none of these places?
That is a good point. Jan, I'll let you speak about this. And again, trying to use the best data, trying to use the science. And the one thing I would say is Peter articulated a pretty good point about this is, and again, that's not a pejorative about that. Each industry is doing what they're supposed to do. They're advocating for their industry. And again, what we're trying to see is how do we bring all of this, and how do we, it's not about prioritizing necessarily, it's about figuring out how do we get those activities that we value, our children being in school. We value the opportunity of folks to have private businesses. And so when we're looking at data, we're looking at that data interacts with one another. So I'm telling you, if we're seeing data that community spread is coming out of indoor seating arrangements, that is going to have an impact on decisions made in schools, decisions made elsewhere. So Jan, maybe you can talk about where we get it and how it's being used.
Well, you know, I think the governor has made the essential points. In terms of transparency of data, I think we put our data out every week, and the disagreement comes around, as the governor said, if you're only going to look at primary cases and say that 1% of all the cases came from known bar and restaurant outbreaks, that's one number. We have said repeatedly that we have a fairly high threshold for what we consider to be an outbreak. It has to be 5 different cases from 5 different households who specifically cite a specific and only that specific establishment. So we know that primary case number even is an undercount, but the more important thing is, as the governor said, each of those primary cases transmits to some number of other people who then transmit to another number of people. So it's the generations of transmission that we've estimated. One primary can lead to 70 cases after 4 generations of transmission. So it's just not that original primary case number. But again, as the governor said, it isn't only about, prove to me that you have, that this number of cases is more than that number of cases. There's consistent information that, and it's no coincidence that even the White House task force, the very first recommendation they make when counties or localities or states are in the red zone for case growth, that you go to these indoor environments where there is a long period of time, where they're in close contact, where they're not masked, and that is the data are abundantly clear that it's the environments themselves that create that risk. It's very, very hard, especially when we've got case growth this high, to precisely attribute, with community spread as it is, to precisely attribute exposures to certain settings. We use this forest fire analogy a lot, but it's because it's particularly apt. In a forest fire, it's very hard to find the hot spot when everything is on fire. So these data arguments about can you prove with certainty that it came from X, Y, Z just get harder and harder to satisfy people with. But the macro level data about the risks of certain environments are certainly we think quite compelling and consistent.
Commissioner, a quick follow-up for you looking at data from Wisconsin. They have had a similar decrease in cases and positivity rate as Minnesota without nearly the level of a shutdown of bars and restaurants and restrictions. How do you explain that? Are you convinced it's the bars and restaurants and those things that are causing the community spread?
We certainly think it's contributing. I mean, no one is saying this is the sole cause. It's an amplification of the spread that's out there. And I think it is hard to answer some of those questions about why is this state different than that state. We do know in Wisconsin some of the larger localities have imposed their own restrictions. So it's not the case that there's no restrictions in Wisconsin, but it's not been at the same kind of statewide level that we've had.
Governor, I'd like to ask over here about a couple of apparent contradictions in this order. You've continued to close indoor dining, but to my knowledge, you haven't publicly pressured casinos to close. You're keeping gyms, you're keeping pools closed, but allowing gyms to open somewhat. Can you explain that? Is that a contradiction there? Because that's what it seems like.
Well, there's a lot of conversations on this. And I think, again, going back clear to the beginning, there is no perfect piece to this. With the lack of a federal plan, we follow CDC guidance, White House task force guidance. We follow the guidance of our internal experts and those externally. In this case, we run these types of things by everybody in the industry, by the medical folks. And speaking about the pool thing, and again, the one that came up about youth sports versus gyms or whatever, an individual activity with someone separated from someone else for a set amount of time wearing a mask the entire time. That's what the gym situation is. A youth sports situation is large numbers of kids closer together and in contact with one another if it's sports. Now, you can do youth sports that are separated, cross-country skiing, anything like that. Situation with the pool, of the masking, of for a longer period of time. There's no perfect algorithm. There's no perfect, and it got into this. I mean, the commissioner's right. One of the things I would say is not having this strategy, Wisconsin, North Dakota, South Dakota, our numbers are not pure because they're bleeding into one another. That's very clear. I think what you can see is probably the best indicator before this surge was North Dakota, South Dakota, and Iowa and Wisconsin were 1, 2, 3, and 4 in case numbers off the chart. We were 21st. That started to erode and bleed away. And so, Steve, I don't know if you want to talk specifically about some of these, but I can tell you these conversations and apparent contradictions, there's always going to be in this. It's a global pandemic trying to find surge in community spread that's off the charts at a time when we're still learning about that virus makes it, and we have learned. We moved things since March and doing more things now than we wouldn't have been doing there. And I think folks need to recognize this. If you take the 50 states and the economic activities in the states, Minnesota has always ranked in the top half of states that economic activities are open and functioning. So it wasn't as if this misnomer that things weren't there. So we're always trying to look at those differences.
I think the governor covered most of it. I would just add there's a notion, I think, in all of the analysis of what can be done here on the predictability of the environment. And a fitness center is just different than a youth sports practice because you're not close together. You can predictably separate from one another. I would note that it's not as if we're going back to the way that fitness centers were before. The new requirements require 12 feet of distance between people who are working out. You must wear a mask the entire time that you're there. Fitness classes are not allowed because those classes are, again, more unpredictable and they bring people closer together by the nature of how they're run. So this is a moderated step back into the fitness area. Again, it's kind of the solo workout model, if you will. You mentioned casinos, and we respect the sovereignty of tribes to make those decisions, and that's why we leave that to those leaders and those governments.
Governor, this may seem like a simple one, but it's got some implications. Do you feel like the vast majority of the state still views these orders as legitimate?
Do I believe the
vast majority of the state still views these orders as legitimate? We talk about some businesses planning to reopen.
Yeah, no, certainly. I think Minnesotans understand. They understand the science behind this. I think there maybe been a little bit of a numbness to this, but I don't think we should ever lose track of that. We have the highest number of people during the pandemic. We have 220,000 new cases today. Minnesota's reporting 92 deaths. We lost more people in 5 days than we lose in a year on the highways during this. And I think most people recognize that this is real, and it makes a difference. And again, I guess it'll be debated, but I'm just going to say point blank, opening everything up and not doing things like some states did killed people and got more people infected. And I think that is not debatable. And so we've made decisions. Has it been perfect? No. Has it had costs that are associated with it? Absolutely. And I think most Minnesotans believe that's the case. Again, as I've said this, there's certainly no pleasure in doing this. I said if I wanted to tell people what they wanted to hear, it'd be wonderful. You know what we should do? We should just do whatever we want. We should just move our entire caucus to South Dakota and have a super spreader event. I'm not encouraging people to do that. Those are the types of things that have made huge impacts across the country. And let's just be honest as Americans. This has been an abject failure as a nation to contain COVID, because there wasn't a set of rules that were followed, a set of things that we know mitigation works. And if you want to compare that to other nations, it's very simple to do that. They took different measures, and those measures involved not only masking, social distancing, it also involved mitigating and shutting down places where the spread was greatest. I will note that most of those nations were able, through their legislators, to quickly and efficiently pass aid packages to support their people. And because of that, here we are 9 months later, 305,000 dead, 18 million infected, our hospitals are still packed, and we've still got some time to go here. So we are trying to use all the tools necessary, and I just think Minnesotans are pretty resilient people. I've had folks that wanted to give, if you recall, 1st of November, you had elected leaders telling us, this thing is over, open everything up. We've got mobile morgue trucks in California today. They are out of body bags because it came back again. You can't pretend this isn't there, and we do need to have the data, and we do need to put it out there, but all that data and all those numbers and all these decisions come back to, let's use the best decisions we can to save people's lives. That's what this was about, and that's what we're attempting to still do.
Governor, I'm wondering if January 10th is it's the next refresh point. I'm wondering if these restrictions could be revised sooner, and what might go into revising those.
And these are discussions. The health people would say, and I think we've continued to say, we need to see where the data is at. I think if the numbers are going, if we get the same response that we got after Thanksgiving from Minnesotans. Obviously, you can speculate of why the 10th and what we're looking at there. We think this gives us, that post New Year's Eve type of thing, post holidays, to let us see where things are at. I believe if Minnesotans do those things, I believe if the trajectory of the troughs and peaks of this pandemic play out, there's a good chance that things will be in a different and better place by January 10th. But like I've said all along, we're going to adjust, whether it's popular or not, to where the pandemic is, and using the best science, the best data, and the best mitigation we can to save lives, reduce hospitalizations, and stop the spread. So Well, I think the timing will be, and again, that's why we're asking. We're recognizing the fact people want to be with one another over the holidays, but I just have to say, we want our kids back in school. We're trying to time that. We want to put the pressure down on this. We want to let the vaccines start to penetrate with large enough numbers. All of those things are coming together at once. The end is, this thing's going to end. This thing's going to end. The question is, how many people get sick and die before that's over, and how quickly we get our businesses back open?
Hi, Governor. I just wanted to ask you about the, I think you just made a reference to it, but I believe the Minnesota Republican Party is planning on holding a winter retreat in South Dakota rather than hosting it here in Minnesota. Do you have any reaction to that news?
Well, again, a lot of folks were vacationing out. I have not left the state. There's places you can spend your money here. We know that there's not a great track record amongst that caucus of maintaining COVID. And so I just, again, I don't think it's a wise decision. In an age with technology, we can do a lot of these things. I won't speak to them because I don't know what they're thinking, but I think taking a whole bunch of Minnesotans, especially folks who fall into the high-risk category, and sticking them in a ballroom with no mitigation efforts is a really bad experiment about what could happen around this. And I think it sends a really...
Governor, just following up on that, people are taking their money elsewhere in youth sports. You haven't specifically addressed that. We do know kids and families are traveling over the borders.
Probably are. A large number are, I think, simply not.
But we know for sure some are training, traveling, playing in Wisconsin, the Dakotas, going south for sure. I know it for a fact that the dollars and the families are leaving and virus could be coming back and forth. And college sports are going, pro sports are going, and these are big numbers, you know. I mean, 70,000 soccer players, 50,000 hockey players.
Cancellations. Mary, I'd go back to this. I simply can't dictate nor enforce to everybody. What I do know is if you choose to do that, you're putting your family and others at risk. You're making the case, and again, I don't think it makes you a bad person. As I said, I think it makes you a good parent that you want to do these things. The fact of the matter is, COVID changes that calculus. So if you simply choose to say, you know what, I think I'm going to do these things, that's how we got into this situation as a country. That's how come we have so much spread in a lot of things. And again, this is hard. This is really hard stuff. And so we're going to try and give people the best tools necessary. Traveling out of state for sports activities or conference things, specifically to avoid or going to states that don't have mitigation places don't have mitigation in place is risky. And I think, again, all the work we're doing, and this isn't me, I just want to be very clear, every single health system, you received the letters from them. I'm standing with them. If those health systems were telling me, you know what, you should just tell people that they can go to every bar and that they can just travel and do this, and we got no problem, where all our ICUs are good, that's exactly what I would be telling you, because that's the facts that are on the ground. So just to be clear, every decision we make around COVID does have implications, and I understand that. Some of them are very painful. About personal things you want to do. They're very painful economically. But they're also decisions that you've heard people stand up here who were firefighters, National Guard, frontline nurses and say, if you do these activities, you're making it harder on me. Please don't make that harder on me as a police officer who has to respond in that. So my advice to them would be is, I hear you. The only thing I could say to all of you is I've got a 14-year-old who I talk to every day about this, wants to be with his team, on a team, wants to play. And we have to explain why we can't. And I know how hard this is.
Governor, getting back to Theo's question about casinos, and I understand the sovereignty issues there, but have you appealed and pressured them to have more restrictions or shut down for their fellow Minnesotans, because they're also Minnesotans? Have you applied direct pressure to them? Because there's no telling how many people are going to casinos and then spreading COVID all over the state.
Yeah, well, I don't apply pressure on anything with sovereign nations. I treat them as the sovereign nations that they are. We have direct consultations. I share our data. I encourage. I will say that our tribal nations followed along, and certainly early on, in many cases, had better success than we did. There might be some cultural nature around that, about especially for their elderly and they're more vulnerable. And they also know very clearly themselves is indigenous nations have been hit incredibly hard because of systemic healthcare disparities. But we do talk to them. The authority for us to be able to make an enforcement, it's not there. These are sovereign nations. These are treaty rights on what they're supposed to do, but we do have great consultation. In fact, we've learned some of our mitigation techniques from what some of them were doing. And so, again, that's the nature of how our system is set up. We encourage them to do it. I think in the vast majority of cases, our tribal partners in trying to mitigate this, because it flows back and forth, have done a pretty admirable job. But that's how we have focused on it.
As a quick follow-up, our education reporter is wondering, are you advocating more testing in schools, especially in the K through 5, in order to get them to be able to open in January?
Yes, and we'll provide it. And I would just use this as a time. Minnesota, we have capacity for testing. You saw that we're asking you, try not to gather if you can, but with an understanding. I want to be with my mom. I want to see my brother-in-law. I want to see my nieces and nephew. One family, masked, separated. Use the testing on this. It's another tool. It's not a get-out-of-jail-free card. Jan, I don't want to get us in trouble on this, but we have this capacity. We can be using it. And when it comes to schools, we are going to do that. Maybe every other week. Do you want to mention that on the testing? Maybe end with that?
So when we're talking about the testing components, we have been able to work to set up a system where using our service cooperatives, which are 9 different regions, we will be able to test our staff every other week to really help to hone in on making sure that they know that they are continuing to be safe. It helps to identify anybody who is asymptomatic who is coming into the building. Now, one of the things we do know is that this program that we are establishing will begin on January 4th, and it is going to be contingent on us being able to continue to fund it. So we are going to work with not only our state legislature, but also our federal advocates to talk about how it is we can continue to provide funding around that. But we will be doing that throughout the state to ensure that our staff has the opportunity to be tested.
Perfect. Well, thank you all. A lot of questions on these days, a lot of important questions, a lot of nuance around these things, but it boils down to this, folks. We're in a 100-year pandemic that is still raging across the country. Our healthcare providers, to a person across this state, you call them up and you can ask them, are deeply concerned about overwhelming their capacity. We're losing an average of 60 Minnesotans a day, and our healthcare numbers are, that capacity is still incredibly razor thin. We know from science and experience there's certain things we can do to slow the spread. Chief amongst those is to wear a mask, to social distance, to wash your hands. We also know that there are certain activities that make the spread greater. We know that this is painful and hard. We provided, as Minnesotans, you have provided help to your neighbors in these industries, and thanking them for helping slow this down by giving them some of that support. This week, a huge change. The dynamics of this started to happen. The vaccines have hit the ground. The virus is now one that we can start to contain. I would caution folks, it's going to take a long time. There's still a lot of unknowns about this to get everyone vaccinated. But as we move down that line will keep coming down. The deaths will start to decrease. The hospital capacity will start to surge. More things can start to happen. And we get to the point where we can do all of these things. Again, you're not going to open the economy if you don't beat the virus. You're not going to have your children back in school and playing sports unencumbered if we don't do this. Just simply pretending it didn't happen or pretending we don't have to do anything and then trying to, don't compare numbers amongst states. Compare numbers amongst nations, approaches to this, because we're all in this together. And that's, I think, the part that I would end with. This isn't us versus an industry. This isn't parsing a number to try and get to a certain place. This is a global pandemic against a killer virus that we've learned much about and have a lot of tools to fight, but we've got a little left to fight. So again, what we're doing today is to try and make those adjustments. You did it during this pause. We came back off that catastrophic peak. We did not see what they're seeing in California. We did not have mobile morgues. and we did not overwhelm our healthcare system, but we walked right up to it. We're coming back down off that. This gets us a ways to turn that dial. Is it frustrating? Yes. Do half the people listening to this want to throw something at the television? Of course they do, because it would be so much easier if none of this was happening. It would be so much easier if the neighbors weren't dying, but that's not reality. And you deserve to have your leadership, your governor, tell you what you need to hear and where things are at, not what maybe we want to hear. So we'll continue to do that, Minnesota. We're going to get through this. We're moving to that new phase. And as I said, that sun is rising. This will be the week of the longest, darkest nights. Next week starts moving towards spring. And that's just where we're at. So thank you all. Commissioners, thank you.